And they look at whether we continue on our current projection, whether we ease mandates. They've added rapid vaccine rollout as another parameter, and they look at universal masking. And just as a reminder, across the country, by observation, we are only at about 60% masking. We are not anywhere close to universal masking. So
that's incredible.
Yeah, it's really incredible. So I'm looking at April 1, so a few months away. If we if the current projection is we would be close to that 2,890,000. If we have easing of mandates, that would go up to 3.2, almost 3.3 million deaths. These are deaths. With universal masking.
Wait, 3 million deaths? No, 3 million.
Yes, deaths globally.
Okay.
Globally.
Wow. Okay.
If we had universal masking, which I think is a fairy tale, because there's a lot of people that are independent and don't want to mask. So if we had that, we could actually reduce that death rate by 300,000
globally
in the world. Yeah. With rapid vaccine rollout, it only reduces it by about 50,000. And that makes sense because most of the folks that are getting the vaccine initially, first of all, it's not all that rapid. Washington State's been pretty darn good, but most of the folks that have been getting the vaccine right away are the people that were being super careful in the first place. So healthcare providers using PPE all the time, and those in retirement homes after the initial cases, long-term care facilities, all have been very, very cautious. So we're not going to make, if we're targeting those for vaccination first, we're not going to make a huge impact initially in the number of cases. There may be a slight impact in the number of deaths. So we just know that. And we are assuming that in that period of time, we will be also vaccinating the 75-year-old and above and others with significant comorbidities. Again, a group that's been doing a pretty good job of taking care of themselves and keeping away from harm. So I think till we can hit the sort of, 30 to 60-year-olds, we're not going to see a dramatic drop in cases and deaths. And just keep that in mind. And really, you're going to hear me say this probably more than once today. Even when you get your vaccine, you're going to mask, you're going to use social distancing. I don't know if you can see it. I've got a, this came from Target. It's like,
stay apart.
Do your part, stay apart. Yeah.
I like it.
Yeah. So, my whole family got them as stocking stuffers, even though we didn't have stockings this year. So that's just really good to keep in mind. Don't get disappointed if you don't see rapid turnaround. In the US, our projected COVID deaths by April 1 is 567,000. So more than 500,000 deaths by April 1. And that's again, based on projections from that December data. If we ease mandates, which there's so much pressure for, that could go up to 731,000, right? And the rapid vaccine rollout will just reduce that by about 12,000. Yeah. Universal masking would reduce that by about 50,000. So again, the more masking you can convince people to do, and do it yourself. So we'll talk a little bit about vaccine in particular. While I'm thinking of it, I do want to mention one thing is that we know that the vaccine will give an individual protection. Right now, if you get the vaccine, you're getting it to protect yourself. You're not really able to protect others from you if you pick up an asymptomatic or a mild case. So just remember that when, you know,
So,
you can
so you
feel
can
better for your,
still spread COVID-19.
we are quite sure you can still
Yeah.
spread if you pick it up. Now,
Mhm.
likely that you're not going to pick it up, but it's also likely if you do get it, that
Mhm.
it's going to be milder or maybe asymptomatic than what it would have been before. And so we may never know if we have it, just like the other asymptomatic carriers in the country. So just know that right now it's to protect yourself. We still want to use our masking. We still want to be cautious. And it's also contributing to the herd immunity that you've heard me talk about before, which depends on the specialist you talk to. Fauci says that would be 80,000, 85,000 vaccinations, or 85,000% of the population. Herd immunity requires at least 70% of a population, and 80% is the target. So just know that's a lot. And also know that there are some people that are not getting vaccinated, including frontline healthcare workers that are either waiting to see how their colleagues do or not going to vaccinate because they don't trust it. So we're
And
never going to
there's,
get 100%. Yeah.
yeah, and just to re-emphasize, because there's a question here from Tina
Yeah.
Hall, you can still get COVID-19 even if you have been vaccinated. You can
Yes,
still
but
get it.
remember the vaccines that we have out right now, both RNA, Pfizer and Moderna, are 94, 95% effective at preventing you getting it, right? So, so remember that. And then the few people that did get it in the trials, they had 18,000 and 13,000 in the two different trials, got, in general, got milder cases. So we're going to talk a little bit about severity in a minute, but I did also want, since many people are, sorry, my dog is talking.
Chip.
Chip, you need to be quiet. Oh, he doesn't want to. Okay, let me give you some Washington statistics. Washington State has, as of the 8th, so that would be Friday, we had 260,360 confirmed positives, okay? Shh. It's estimated that it's probably another 11,000 more than that didn't get tested but were positive along the way or still. The death rate in Washington State is 1.4%. So as I and others predicted, the initial 5% death rate was because it hit those really high-risk people, the elderly in the first place. But the what we're running at is 1.4%, and what I've seen globally is a 1.1% death rate suggested. And that means that 3,000, almost 700 people in Washington State have died from COVID. And the other thing to think about, and that's a big problem right now, we're doing quite well. We may be plateauing. We still have some hotter counties in Washington, but we still have hospital strain. So we've gone back to fewer elective hospital cases unless they can be done in an outpatient surgical center. And we still are trying to preserve our inpatient setting for sick people and for COVID positive people as much as possible. So we've asked surgeons not to do an elective or even semi-elective procedure on someone that has a high likelihood of needing intensive care unit afterwards. And we've kind of gone back to the, if delay is going to be harmful, of course you're going to do it. But if you can wait a few months, that's probably better, especially right now. We are at Swedish accepting patients from across the state, and the whole state of Washington has epidemiology and Department of Health coordinating which hospitals get transfers, and that allows the rural hospitals to take their MIs and their, everybody else that they need to admit locally. So just let you think about that for a second. I'm just going to step away for a minute and let this darn dog out. Come on, go out.
And everyone, hi, I'm Robin Shapiro, and we're excited to have Del Reisner who you just heard from, talk and give us some updates about COVID-19. And we will hear also from Kristen Tellini, who is a HealthAdvocateX board member, and in her paid work, she is a health advisor for Pinnacle Care and also vice president of member services. We'll hear from her in just a few moments. And several of you have written in to ask about how you as an advocate can get access to the vaccine, and we will be addressing that on this call. So Dale, back to you.
Okie doke. Now he refuses to go out, but he keeps talking. So I'm sorry. I'll see if I can try to get him to settle down. This is a little atypical for this guy. What I did want to talk about is the different phases of vaccine rollout. And Kristen's going to talk to us a lot about her access to this information across the country. And then I was going to finish at the end with some details about what you can expect from the vaccine when you do get it. So what I did want to talk a little bit about is Washington State, and also want to put into perspective that if you're from a different state, please go online and look at your state COVID. You can generally get it. Kristen's going to show you some access links, but you can generally get it just by putting in your state initials, like for Washington, it's wa.gov.doh and COVID. And so you can do that for Montana or for any other state. So in each state, the phases are slightly different, but the general principle is the same. To vaccinate the highest risk folks initially, and to incorporate as many in the next up portion. So in Washington State, we have phases 1, A, B, and C. We have then 2, 3, and 4. So we are in phase 1. We started that in December when we got our first Pfizer vaccine in the state, and then followed by Moderna. The Pfizer came the week of the 14th of December, and Moderna the very next week. 1A is high-risk workers in healthcare settings. So it's not just healthcare professionals, but it's the environmental services people, and it's the dietary people, and it's everybody that works in a hospital or another healthcare setting that would potentially be exposed. And then high risk first responders, so our EMS folks and people like that. There's a second set of high risk workers that don't work in hospitals, and some of you may be these very people that have patient facing exposures. Oh my gosh. That have patient facing exposures that are going to be at high risk and are in the sort of second component of 1A. So the 1B are people who have comorbidities, medical conditions that are underlying that put them at higher risk. And it's usually 2 or more. So diabetes and hypertension are really common, or obesity, and we're talking about significant obesity and hypertension. It doesn't seem to matter whether your issues are controlled, although if they're poorly controlled, it does make a difference. And then people living in congregate or overcrowded settings, as the safety story I talked about, for people that may be at a younger age or that have comorbid diagnoses. So the mental health disorders are considered comorbidities as well as age. Yeah. And then 1C are critical workers such as agriculture, food processing, those people. And then we move on. I won't go into the like phase 2 and 3. Teachers come up. Teachers are kind of pushing to be made more like 1C, and you can say that there's a good reason for that. As we get more vaccine, we've had problems with our acceptance of in terms of the national government of accepting more vaccine than we could have. And so I am hoping that by the end of January, that will be opened up a bit and we will actually see bigger volumes of vaccine coming wherever you live. We are seeing stories where different states are having people that aren't in those highest risk categories getting vaccines before their peers who are working in those higher risk situations, and that's not really okay, but you know, it's state by state, and
in some instances, it's a situation where the doses are going to go bad, and so they're just trying to make sure that they get it in the arms, right?
Yes, but one of the things that's really important about this vaccination program is being able to track so that you can get a reminder about your second dose. So we're not just going to pick somebody in off the street. There should be still parameters for vaccine. First of all, you should have a scheduling process, and you should know approximately how many doses you're going to be giving. And within that setting, if you had a backup list, but the backup list still should be people that, you know, need to have access. So I know that hasn't been happening everywhere. There've been some, you know, 20-year-olds that work at a desk in a research lab or that kind of thing that they've talked about in some other states getting the vaccine. And, you know, it's hard to think about that if you are someone that's in the more moderate risk, but definitely risk higher than a 20-year-old who's not doing direct patient care. So just bear with that. I don't think that's happening in Washington State. I think that all of the excess vaccines we had the very first week in the Swedish system, we had excess vaccine that got defrosted, and we were able to pick up additional people in the hospital. So if you're in a clinic setting, you may be able to do that. And I think as the clinics become more community-based, and Kristen will talk about this a little bit, there are starting this week, opening, if not already, multiple areas across Washington that are community-based clinics. They are initially focusing on that second phase of 1A, which is if you are not able to do your job virtually, if you do need to be in either patient facing or in a setting where they're a hospital or so on, if you're an advocate for a cancer patient who's going in for therapy and the cancer patient wants you to go with them, you would be somebody that would fit into this setting. But it's also aimed a lot at offices that are outpatient offices that don't have any kind of a hospital privileging or that kind of setup to have been able to be getting it at work already. Large groups have done a pretty good job of purchasing and getting their own. And I think there are a few pharmacies that are able to do that, but there's not at your local Walgreens or Rite Aid right now.
And I was just saying to Tina Hall, who's with Era Living here in the Washington State area, they are actually setting up on-site vaccination clinics for their staff as well as their clients. So thanks, Tina, for sending that. And she said so far in their communities, residents, there's a 98% participation rate, which is fantastic. So kind of interesting.
Yeah, and I'd like to turn it over to Kristen now to talk a little bit about all these different options, and then we'll get back. In the meantime, I'll try to convince the dog to go out.
Thank you.
Yeah, so I think Dale covered most of the phases for Washington. I did send a link in our chat feature, so you can read it yourself and see how it's been designated for Washington State. As far as nationwide, I work with teams across the US, so we're trying to stay on top of what is happening in each state, and then how do we schedule appointments for our clients. And every state, like Dale said, is very different in the way they're defining the role and the way they're rolling out the phases, with some very basic principles that are the same. So one link that I included in the chat was to WebMD, which actually, if you click on that, you can see they made it easy for us a little bit and putting all of the states listed, and you can go to each state if you're curious or you're calling in from a different state. It should take you fairly directly to the government website with everything listed and which phase.
So if you're
each
an advocate, you can go onto that WebMD link and get some guidance as to whether or not you might qualify for the vaccine right now in a patient-facing, role.
Right, and every state has worded that differently. There are some states that are opening it up to all RNs. If you have a license, you might want to check in with your board to see, which, what you qualify for an MD or an RN, and it kind of go from there. So that's just in general. And as far as Washington State, just kind of going back to what Dale said, which is what I'm most familiar with as far as patient advocates getting, which I know was a big question coming into this call, getting vaccinated. It does look like she said, if you're somebody that's meeting people in the emergency room when you need to, or having to accompany them to appointments, and you have that face-to-face contact, that you would then be in the phase, the second tier of 1A, which is worded, and I'm actually going to pull up my screen real quick to make sure I get the right screen here. See if I can share this. Hold on 1 second.
Yep, we can see it.
It's not quite that. Can you guys see this screen?
Yeah, yes.
Okay. So if you are in the second tier 1A, and you are not in a health system, employed by a health system that's providing the vaccine, through the Washington State Department of Health website, you can get to this page, and it gives you specific instructions for unaffiliated workers on how to obtain the vaccine. So I won't read this to you, but you can find it, and I can put these links in our chat when I hand it back to Dale.
That's great. And so for people who are not in Washington State, you might just look at it in terms of where you might find similar information for your particular state.
Yeah. And I might have lost my page for it, but there's also, you can get to the website. So once you go on, I think it was actually linked. I'm sorry about it. But I'll get to it. What I want linked here as far as the list of providers that you can make appointments at. And the way it seems as though Washington State is working is that you can go by county. If you can see this, let's see, I'm gonna choose King County. And then in King County, you can actually submit. They have a list of where you can go directly to these clinics for the vaccine. You would follow on that last page the instructions on what you need. So some say a voucher or a letter saying that you're client-facing, patient-facing work. And then if you go here to, they have a kind of central point where you can submit your information as well. And they are asking that you go to phasefinder.org. I don't know if you guys have seen that yet, but in phasefinder.org, anybody can go to that site and put in your information. It's going to ask you a handful of questions. You put in your information and they'll tell you if you're eligible now. And if you're not, it will ask if you want to be informed when you're eligible by text or email. So they are asking that you've confirmed through PhaseFinder on here before you fill this out and submit it. And then if this all goes as they say it should go, you should get notification to schedule when your phase is open and when they're able to, and they have availability for the vaccine at that phase. And that's really phasefinder.org you can use for anybody at any phase,
anywhere in the country.
Well, that's for Washington State, but they do each state going to the government website. I've seen similar sites for California and other states as well that are doing the same thing. So that's kind of as far as what you can do as a health provider in Washington State. They are that tier 2 of the phase 1A, keeping this all straight. They do word it very specifically as workers in a health setting. So they're not saying that this is after all of the frontline healthcare workers and caregivers have access to the vaccine that want it. So that is kind of the overview of that piece. I just wanted to kind of mention and provide a little insight on what I'm seeing. It's a little Wild West in Florida. They opened very broadly, very quickly. So they're doing Florida, Georgia, I think, are doing 65 and up right now. I believe Colorado, Alaska, New York, and several other states are already opened up to 75 and older. We will probably see, I'm hoping in the next week or so, 70 and older for our phase 1B in Washington State. I have heard that some hospitals like Overlake are already reaching out to patients to schedule in advance. It's
That's
not available yet, but they're proactively doing that. I don't think every system's doing that. But I would also recommend just keeping an eye out, especially if you're a health advocate that's helping other people access and find the vaccine, to keep an eye out on their hospital systems landing pages. They're usually showing you how to schedule appointments. Keep an eye out to their patient portal. If that usually goes into junk mail, make sure people are really paying attention if they're getting an email from their health system about scheduling. And then just because I have a lot of people I have to keep an eye on the vaccine for, I've set Google alerts for myself on California and COVID vaccine, or Washington State COVID vaccine. I only use Twitter for this purpose right now, and to find the orcas when they're coming through. Otherwise, I'm not a big fan of Twitter. But yeah, so that might be something to just stay on top of the information, because it's slow, and then when it moves very fast. Otherwise, and then the only other thing I think wanted to mention was that, also keep an eye out for scams. There are definitely, Florida was using Eventbrite. I think you guys might have seen this article or in the news, to register for scheduling. And it was completely legitimate, but then somebody posed as Eventbrite and was charging people to register for Eventbrite. So anytime people are being asked for money or anything like that, it's a red flag, and just maybe for the families you work with to make sure they, are aware of that. So that is, I think.
You also mentioned that for people who might not necessarily be patient facing, but who are really interested in getting the vaccine as soon as possible, there are also opportunities to volunteer sometimes. And that might lead to getting the vaccine earlier. And people on this call might be interested in this.
Sure. Swedish is doing some clinics with Seattle U, so I'm sure Dale can speak a little bit more about that. And they do say right on the registration for volunteering that you will be vaccinated at the end of your volunteer shift. That is for people who are nurses and non-nurses. So anybody can volunteer. They need help with the flow and sanitizing things and all of that stuff. And I'm also talking with someone who's in charge of the vaccine clinics at Virginia Mason later today. So if I have more information, I'll pass that on to Robin as far as how broadly they're looking for volunteers as well. I don't know if they're vaccinating yet, so, but yeah.
I just wanted to add that, I did volunteer at Swedish, and the only way you get a vaccine is if they actually have extra. They're not planning on vaccinating all the volunteers. That might have changed, because that was, a week and a half ago. So, but I would have taken a vaccine if they offered it.
I think that is different now. There's vaccine for, the thing that's fascinating about the vaccination is you've got first vaccines and you've got second vaccines, and keeping track of the number of doses you need. So for instance, we got Pfizer first, and those who got the first vaccine are supposed to come in 3 weeks later approximately and get the second vaccine. And so making sure that that there's enough Pfizer for the people to get the second vaccine, I think was a little bit of a glitch there. We actually chose to do Moderna, because we got that later and we got more of it on Edmonds and Issaquah. So actually those campuses started a week later than First Hill. But we have vaccinated thousands and thousands of people at First Hill, and some of the providers from those other places were coming and getting their first vaccine at the First Hill site. But all of the major sources for vaccination currently are going to be moving to clinic-based access. And I think that's
so what does that mean?
Well, that's so Swedish will continue to support vaccines. Right now, it's still 1A, the second part of 1A, and those later adopting or later signing up people that were first part of 1A. But soon the community clinics will be opening up, if they aren't already in some sites, to the next phase. And so would be all the 1Bs or, that kind of thing. And so what I envision is there are a lot of people that have signed up as volunteers right now. But I think they're gonna be an ongoing need for volunteers in 3 weeks or 4 weeks from now, when the broader community needs to be served. And we're trying to get as many people there to run those programs as possible. Yeah.
So we have a question from Dr. Sema Khan, who's here in Washington State, about can you talk about the differences between Moderna and Pfizer, and if people even have a choice, and are they different?
Sure. Funny you should ask. Yeah. So they are, you probably already know this, are both RNA viruses, which are vaccines, which are novel. And they do not have any live virus in them at all. And there are next vaccines that are coming along that are different process. So right now, the only two that look available that are this type are the Pfizer and the Moderna. So they have very similar effectiveness. I think Pfizer initially reported less and then came back and said 95% effective. Moderna says 94% effective. I would just like to say, I'm going to talk a little bit about some differences, but honestly, whatever you get offered, take it. The other thing is on the second dose, I think people were really stressed out about getting in and getting it exactly at 3 weeks if it's Pfizer or 4 weeks if it's Moderna. And there is a leeway. And now even nationally, people are saying, if for some reason you get sick and that's not the time to get another vaccination, don't worry about it. When you're better, go in and get your second vaccine of the same company. And don't worry about it, because probably that's still going to boost your effectiveness of the vaccine. The other thing to think about is that it doesn't reach maximum efficacy. So that is the ability to keep you from getting the virus till 2 to 3 weeks after the second dose. So you will get some immunity after the first, but it's not as good as this, probably in the 60% range, 60 to 70%. And you really want that second dose. So there's been some discussion amongst people across the country about maybe we should just use one dose for everybody and get more people, but then you're going to have people that are not adequately protected. So you definitely want to do the 2 doses of whichever one you get. So having said that, I do want to start with, there's some misinformation about anaphylactic reactions. And so I wanted to start with that. Out of 1.9 million people in the United States who either by the research or as of now have been vaccinated, there have been, so out of 1.9 million receiving the vaccine from 12/14 to the 21st of December, 21 had a severe anaphylactic type reaction. It's 0.001%, incredibly low risk. of those 21, the majority, I think 17, had some sort of prior severe allergic response to vaccinations and that sort of thing. So it's not your peanut allergy or things like that. There's no peanuts in this.
That's
And
helpful to know, because
Yeah.
so many people are worried about,
yeah, and typically what you're reacting to is not the core part of the vaccine, but all of the preservatives. And there really isn't preservative in these two RNA viruses, whereas there will be probably in some of the upcoming viruses of vaccines, that especially AstraZeneca has one, and there's another one that's that's lagging in terms of when it will be available, but that they're hoping can be disseminated in warmer climates where they don't have as much refrigeration, and those all will have thimerosal or some other preservative in them. So these are better in some respects because of the need for the cooling.
Can you talk also about, I think there was some, not to interrupt your train of
Yeah,
thought, but
no worries.
I think there was some question about if you get one type of vaccine, can you get the other vaccine as the second one as a follow-up? Can you just clear up any myths
Yeah,
that might
you
seem
really
obvious?
need
But
to, yeah, you really need to get it the same vaccine. So, you know, Beth, who's not in Seattle right now, had she been vaccinated with Pfizer when she was volunteering, she would need the Pfizer. So if it took her a while to get it, then that would be fine, but she would need to get the Pfizer. So,
and the reason why is they haven't done any clinical
there's no
trials to look
cross
at the
trials,
crossover. So
correct.
even
So
though
you
they're
don't
very
wanna-
similar,
yeah.
they're not the same. Yeah.
You don't want to mess with the potential of not having a proper coverage. So that people are being very careful about that. You'll get a little card where you and it's from the CDC and where they track. And then there is a CDC phone tracking called VSafe for vaccine, V-safe. And you can look that up on the cdc.gov coronavirus and put in vaccines and what to expect and so on. When you get your vaccination, they should give you the information to sign up for VSafe. And I have been vaccinated because I've been unable to do part of my job, which is inpatient. So I will be able to resume some of that for my own protection in another few weeks. But it's very cool because the day you get your vaccination, later in the day, it texts you and asks you if you're having any symptoms. It's tracking. So we'll have national data that will really be helpful for folks. And it's also a connection for you. And obviously you check in with your provider if you have serious side effects. And it checks every day for the first week. And then I think weekly or something like that. I can't even remember thereafter.
Have they ever used anything
And
like
it
that?
reminds you to do the second.
Reminds you to schedule your second one, all of that. I don't know if they've used it for other things or not, but it's super effective. And the other thing that's nice about not, and I don't know how they'll do it in places that have excess and they're getting people come in at the last minute, because you really need to be able to have the organization track. And also through Swedish, we had reminders. So I was getting reminders from both places, which was just fine. So, and when you go to a place that has a really smooth scheduling system, it's pretty darn quick. And you're going to stand in a line and you're going to do physical distancing and all of that stuff. The thing to know is the most common side effects are pain at the site and swelling. The other things that people are seeing, fatigue, headache, fever, chills, things like that. The symptoms typically and really rarely go beyond 48 hours. So from day 0 to 48 hours after. I'm going to give you some numbers. And they're pretty darn similar. So I'll start with Pfizer. Compared to Moderna, there were fewer reports of pain, fatigue, and headaches in the Pfizer vaccine trials. The most common effects were pain at the injection site, which was 84%. And that compares to Moderna, which had, where'd it go? They don't even, 92%. So slightly more. The next was fatigue, which was 63%, and 69% in Moderna. So again, pretty similar. The third was headache, 55% for Pfizer and 63% for Moderna. And then the Moderna had some muscle pain complaints that were about 60% that didn't seem to come through very often with Pfizer. The other thing that's quite fascinating, it's the only time I've been thankful to be old, is if you are young, you have more significant side effects. And if you're older, you have fewer side effects, which is kind of nice. The highest rate of the side effects that I mentioned were in volunteers under 55 years old. And then in that group, 5% had severe fatigue, about 3% severe headaches, 2% had severe chills, and 2% had new or worsened muscle pain. That was in the younger folks for Pfizer, and Moderna saw the same thing. The younger participants had more side effects, and they were fatigue about 11% in the younger group, muscle pain 10%, joint pain 6%, fever 2%.
I'm assuming that those numbers are for both injections combined.
Those are in general. However, most of the both of these companies are reporting a little higher rate of complaints of these same side effects after the second dose. When you talk to people who've had the vaccine, it's all over the board. So some say, oh, it hurt me more the first time and I did fine the second time. So I don't know the percentage where it might be, but there was kind of a tendency maybe to be on the second one.
Can you also talk a little bit about the vaccines and the variants, the new variants of COVID-19 that we're seeing?
Yes, I can. So they are pieces of mRNA, not active virus, that are in the vaccines. And what happens is these coronaviruses have changes in their composition quite frequently. I hate to even call it like mutation, but that's what typically you might think about. Which is why there's never been a good vaccine for the common cold, because it changes all the time and it's a coronavirus. So there's a variant out that is more infectious, not necessarily more severe, but more readily caught. And people have been worried about the vaccine not covering. The vaccine makers and the epidemiologists and infectious disease people that I have heard from Washington State are not worried about you not having coverage. If there were to be a trend with other alterations in the virus, there were to be a trend toward less infectivity, at least with these first two messenger RNA based vaccines, I think that it is a minor change, a minor addition to alter those to pick that up. But right now, nobody's in the process of doing that with the variant that's out there that's a little more readily spreadable. Yeah.
Thank you.
Yeah.
So, and folks, if you have other questions, please put them in the chat. So we do have a question from Eileen Mandel. What about a reaction of Bell's palsy? Any data on that?
I believe one of the things I read, I don't have any numbers on it, did show that, but really was a rare event.
Mhm.
The findings that people had mostly were like acute illness type thing. Now, obviously, when you have the illness, you can have more likely have things like Bell's palsy and that sort of thing, because you may be actually having um, um, either attenuated or live virus or whatever, depending on the vaccine that's being used.
Mhm.
So I'm not sure that that's actually going to be something that we see that's truly due to the vaccine for those two. We may see it more with some of the other viruses. They will be the AstraZeneca vaccine that's coming up is based on a viral vector, and it's not replicating. So it's like, if you want to think about it being denatured, but there is some viral component, and that I guess maybe could have that kind of association more than these messenger RNA ones, but
Hmm.
it's not something we've seen really reported in any degree.
Okay, interesting.
Yeah.
So what other questions do you have for folks on the call? Thanks. There was a lot. I mean, there's still a lot going on.
There's a lot going on, and we're going to have to be patient with it for
Mhm.
sure. I'm kind of hoping that at least by Christmas, we've got enough people vaccinated that we can, maybe Thanksgiving and Christmas have family things going on. It's
Mhm.
going to be gradual. Yeah.
What percentage, do we have any statistics about what percentage of like frontline healthcare workers in hospitals are choosing to not get vaccinated, and for what reasons?
Yeah, I don't know, Kristen, if you've heard anything there. What we've seen at Swedish is a mixture, and this is mostly based on sort of different department reporting that I inquired with. Um, it's certainly not 100%. Part of that was the initial sign up. Some people didn't. So there was a reach out to all employees and providers that have hospital privileges to complete a survey for your interest in the vaccination. And actually, I put myself in, I go to areas where we have patients, but I am not patient facing. But because I'm in that area as a healthcare worker, but not necessarily a caregiver, they included me in the first batch, which I was kind of surprised, but it does fit the state requirements. And we were seeing some employees say, well, why didn't I get an invite to sign up for the vaccine? But they put moderate interest in the vaccine, so they didn't get prioritized. They've all been vaccinated by now, but so it was a week later. It's not, it doesn't take very long. There are a few people that are really holding back and waiting to see how their colleagues do. There are some people, a smaller number, that are not going to take any vaccine no matter what it is. So we will, I think Washington State will have our usual group of people that are against vaccines and
Yeah, we have a
going to
big,
do it.
big
Yeah.
contingency.
Yeah.
I just wanted to mention also that Kristen Tellini has posted in the chat the findyourphase.org. And it sounds like the link is really slow, but it is working. So please take a look at that. And
Yeah.
It is
also
find your phase, sorry, WA.org. Sorry, Robin, I just wanted to make sure, but it's in my
Find your
chat
phase.
section, and it is kind of slow, but it has worked, and we'll see if they notify us in a timely manner.
Yeah.
Time will tell.
And there's a question about home workers too. And so I know that people who work in long-term care facilities and those kind of folks are prioritized, but your cleaning lady is not. So if it's a facility, and they're home workers for a range of things, whether it's dietary or whatever it is that's on site. Those people are in phase 1, 1A, and I think they've been included in the first phase if they have access, and if not, it would be the second phase of 1A.
And Tina Hall, I don't know if you're still on the line, if you can comment, or if you
I'm
have
here.
I see her face.
Hi, Happy New Year. Nice to see you. Do you want to jump in here and say anything in terms of what you're seeing in your communities and with caregivers?
Sure. We offer the vaccine to all residents and on-site staff at all of the Era Living communities. And almost without exception, the residents all said yes, they wanted it. Many of the employees did. We actually have a lower participation rate among employees than we have among residents. A lot of it is actually based on religious objections, which surprised some of us. And then we have a list of people who are alternates. Because I'm not an essential on-site person, am an alternate, and I got a call like at the very last minute to hustle over to one of my communities because we had 1 dose and they didn't want it to go to waste. So I ended up getting my first dose.
Yeah.
I did get the headaches. I did have a really sore arm and I was fatigued for a few days. So everything that you're saying. But other than that, in talking with the executive director this morning, we haven't had any adverse reactions among anyone that had the vaccine, and we had the Pfizer vaccine.
Nice. I have a question here from Vanessa Laughlin of Bannister Advisor. What about spouses who are under 70, but their spouse is over 70 in the same household, like 65-year-old wife, 75-year-old husband? Do we know if they qualify or not? That's a great question, Vanessa.
Yeah, they're not. They could go volunteer at a clinic. If you live with somebody with comorbidities who's a vaccine candidate, I would suggest doing that. We're going to need a lot of volunteers in the next few weeks and months. And I think, what happens with this sort of thing is you get a lot of people pony up initially, and then, they sort of forget about it. So keep that in mind. I think, and remember, we still have to be careful when we go out and all of those things. But it's going to be by age unless you have a comorbidity. If you are, and maybe it doesn't make sense if you're caring for your loved one because you live there, but if you're not an official caregiver as a healthcare worker, you're not going to be in that higher priority group.
Yeah, I'm hoping to get picked to volunteer because my husband and I are end of the line, so I really want that vaccine. But I know we have just a few minutes more, and I wanted to just mention we are doing our community conversations monthly now on the second Monday of each month. So you can put that on your calendar, and we're starting to schedule out our speakers and leaders. We are so excited to welcome February 8th, which will be our next community conversation, Vin Gupta, who is a chronic pulmonary and critical care doctor at the UW, and also is associated with the Institute of Metrics and Evaluation. And that's the organization that Dale has been quoting their metrics. They're nationally recognized. And Vin is actually a nationally recognized expert. So thank you to Beth Droppert for securing him to speak. Next month, we'll be talking about acute and long-term pulmonary events related to COVID-19, and he can speak about a lot of different things, but we're especially going to be digging into the acute and long-term effects. So don't miss that. Make sure, spread the news. We're so lucky to have him, and we're busy scheduling other people out as well to make the most of our time together. So before we end today, Kristen, Dale, any final thoughts?
I see a couple questions just about specifics. I don't want to get kind of in the minutia of saying who's eligible, who's not. The links that we provided will say, you know, if you were a face-to-face caregiver, you know, healthcare provider, which phase you're in, which tier you're in. And then it'll just be a matter of getting that notification that they have the vaccine available for that tier. So I think to some of your questions, yes, that is being provided now or very soon. So I'll keep it to that, I think.
Thank you, Kristen. Thanks for
Yeah.
jumping on and sharing your wisdom with us today. Dale, any final wrap-up comments?
You know, the only thing that I was going to mention is that if you are working with anyone who is pregnant, vaccination is actually recommended by our national organizations because the data across the country has shown pregnant women get sicker, more ICU admissions, and so on. We haven't seen clear fetal or newborn complications that we can really say are associated with the infection, but they were not part of the original study. And we expect that they would respond just like any other adult their same age. However, that has to be a personal discussion with that patient and with the provider. So they are a little higher risk in terms of the hierarchy of when they would be offered. But like what you're hearing, some provider groups are reaching out to some patients. We know that there are some pregnant women that are going to be asking for that. And just so you know that it's not shown in any of the studies, but that we feel like it's a safe enough thing to do compared to what the live virus will do.
That's great. Well,
Yeah.
thanks, Dale, and thanks, Kristen, for leading us through what is the most recent. Really appreciate you sharing with this. And I'm just reading. And we will, if you're interested in volunteering, just send an email to info@HealthAdvocateX.org. And we'll go ahead and pass along the volunteer link here in the Seattle area if anybody's interested in volunteering. And I just want to say thank you. Happy New Year. We're excited to have a year that will be better than last year. So with your help.
With a little help from our friends, right?
With a little help from our friends.
Yeah.
Exactly. So we'll see you hopefully next month. And we do have also a networking meeting on February 4th. So sign up for that. Thanks, everybody.
Bye.
Bye.